Given all of this, and I could see and envision and see that how many technical challenges could be faced, especially in healthcare, regarding HIPAA, regarding privacy, regarding cybersecurity. And have you seen problems? How do you deal with this? What is your approach with this?
So we follow obviously very heavily the regulatory frameworks for these things, right? So we do, as I said, we do try to stay ahead of the curve. So we do follow the frameworks that are being put out there. I think there are some very good aspects here. Heavy testing, heavy making sure that what we build is sound and what we build is safe. I think that is something that is baked into what we do, right? Going back to what I said in the beginning on the founding of Dawn Health and where that comes, right? It is a tech company specialized in healthcare, and I think that's a very important part. So originally, it does come out of a sort of broader conglomerate as well that works a lot across sectors. But the interesting part is that you can ask anyone that works in a big tech company in health, I think, but even in the smaller ones, healthcare has its own intricacies. So we work specifically in healthcare. So we do know all of the regulations. We do know all of the security frameworks, all of the regulatory frameworks, and we check them very constantly at the beginning of the projects. As I said, right, like when someone comes to us with an idea, that's when people from these scenarios get involved, right? It's not like we're just drawing something up on paper and then we'll run it through, is that technologically possible? And then we start developing, and then it gets dropped onto, someone in a consultancy saying, okay, so how do we make this regulatory sound and like safe and so on and so forth? No, for us, that all starts right at the beginning. I think that's the part that, as you mentioned, right, like all the stakeholders need to be aligned. That's the same on our side. Everyone needs to be on the table and everyone needs to work together, right? I went back to why we want everyone to sit in the same office. It's exactly for that specific reason, so that there is nothing lost in translation, nothing lost anywhere in the process, because I think that is where a lot of solutions break.
Thanks for watching, and I appreciate you as a valuable viewer. And if you liked this segment, you can watch all of the different individual segments or the whole podcast to have a broader understanding on this topic. Just check the links in the description or what you see on the screen right now. I'm Dr. Umer Khan. Looking forward to seeing you again. Thank you.